in this course, we're able to discuss, as you mentioned, common approaches to overall the different sleep disorders that are available, but of course specific to then parasomnia, or people having abnormal behavior during sleep. And we always started with a great history, a very good history about the person's sleep patterns, how they sleep, and the like. And then we also discuss the different methods that we can use to assess a sleep and circadian rhythm disorder, which go from the classic polysomnography, or a sleep study that happens within the sleep center, to also things like doing studies at home, like a home sleep apnea study, or many of the things that people can actually do nowadays with the so-called wearables. So things that you wear at home, and you can get information about their sleep patterns, timing of their sleep, the sleep duration, and the like. And even though many of these devices are not considered to be medical grade devices or even research grade devices to some extent, patients bring this to the clinic, and we use them to help them make healthcare decisions many times. Some of the main challenges, I think, still have to do with understanding how sleep disorders can affect someone's function and daily living, and some of these other medical disorders that they may have, medical or neurological disorders. So, for example, we know that many patients and potentially some physicians may attribute, for example, fatigue or lack of energy or something along those lines to either a side effect of a medication, or just the aging process, for example. And many times it's just the person might have a sleep disorder that goes unrecognized. So trying to change that culture of where we think of sleep as one of the main things, or one of the things that should be in the forefront when trying to address any of the patient's issues. I think that's one of the main challenges. The other challenges that we often see is really just access to sleep centers, to sleep physician, to treatments. Many patients are not able to go to a sleep clinic or have a sleep center nearby, or even have access to any of the studies that could be done at home. So just really trying to access any of these someone with the expertise to do so. I think is the other main challenge that we often encounter.